The shoulder joint is classified as which type of joint? A. Hinge joint. B. Ball and socket joint. C. Pivot joint. D. Saddle joint. Answer: B. Ball and socket joint. Explanation: the shoulder joint, glenohumeral joint, is a ball and socket joint. The head of the humerus, the ball, fits into the shallow glenoid cavity of the scapula, the socket, allowing for a wide range of movement. The glenoid cavity of the scapula is deepened by which structure? A. Coracoid process. B. Acromion process. C. Glenoid labrum. D. Spine of the scapula. Answer: C. Glenoid labrum. Explanation: the glenoid labrum is a fibrocartilaginous structure that deepens the glenoid cavity of the scapula, providing better stability and allowing the humeral head to fit more securely in the glenoid cavity. The rotator cuff muscles of the shoulder joint include all of the following except: A. Supraspinatus. B. Infraspinatus. C. Subscapularis. D. Teres major. Answer: D. Teres major. Explanation: the rotator cuff muscles include the supraspinatus, infraspinatus, subscapularis, and teres minor. The teres major is not part of the rotator cuff but assists with shoulder movements. The rotator cuff stabilizes the shoulder joint and allows for a wide range of motion. Which ligament provides stability to the acromioclavicular (AC) joint? A. Coracoacromial ligament. B. Glenohumeral ligament. C. Acromioclavicular ligament. D. Coracoclavicular ligament. Answer: C. Acromioclavicular ligament. Explanation: the acromioclavicular ligament is a key ligament that provides stability to the acromioclavicular joint, which is formed by the acromion process of the scapula and the clavicle. The shoulder joint is most prone to dislocations in which direction? A. Anterior. B. Posterior. C. Lateral. D. Inferior. Answer: A. Anterior. Explanation: the shoulder joint is most commonly dislocated anteriorly. This is due to the relatively shallow glenoid cavity, which provides limited stability. The head of the humerus typically moves forward, often tearing the labrum and ligaments. Which of the following muscles is primarily responsible for the abduction of the shoulder joint? A. Deltoid. B. Supraspinatus. C. Latissimus dorsi. D. Pectoralis major. Answer: A. Deltoid. Explanation: the deltoid muscle is primarily responsible for shoulder abduction. The middle fibers of the deltoid are particularly important in initiating and maintaining abduction once the first few degrees are completed by the supraspinatus muscle. Which of the following ligaments stabilizes the shoulder joint by connecting the clavicle to the coracoid process of the scapula? A. Coracoclavicular ligament. B. Glenohumeral ligament. C. Coracoacromial ligament. D. Acromioclavicular ligament. Answer: A. Coracoclavicular ligament. Explanation: the coracoclavicular ligament connects the clavicle to the coracoid process of the scapula. It helps stabilize the acromioclavicular joint and prevents upward displacement of the clavicle. The shoulder joint is stabilized primarily by which of the following structures? A. Biceps brachii tendon. B. Rotator cuff muscles. C. Trapezius muscle. D. Latissimus dorsi tendon. Answer: B. Rotator cuff muscles. Explanation: the rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, stabilize the shoulder joint. They help keep the humeral head in the shallow glenoid cavity during shoulder movements. The acromion process of the scapula articulates with which bone at the acromioclavicular joint? A. Humerus. B. Clavicle. C. Sternum. D. Radius. Answer: B. Clavicle. Explanation: the acromion process of the scapula articulates with the acromial end of the clavicle to form the acromioclavicular joint. This joint allows limited movement and provides stability to the shoulder complex. The glenohumeral joint is primarily stabilized by which of the following? A. Ligaments only. B. Tendons of the biceps brachii. C. The rotator cuff muscles and ligaments. D. The clavicle. Answer: C. The rotator cuff muscles and ligaments. Explanation: the glenohumeral joint is stabilized primarily by the rotator cuff muscles and various ligaments, including the glenohumeral ligaments. These structures help prevent dislocations and provide support during shoulder movement. The bursa that lies between the acromion and the deltoid muscle is called the A. Subdeltoid bursa. B. Subacromial bursa. C. Infrascapular bursa. D. Olecranon bursa. Answer: B. Subacromial bursa. Explanation: the subacromial bursa lies between the acromion and the deltoid muscle, acting as a cushion to reduce friction during shoulder movement. It is frequently involved in conditions like rotator cuff tendinitis. Which of the following is a function of the shoulder joint's labrum? A. To increase the depth of the glenoid cavity. B. To allow for greater shoulder flexion. C. To limit shoulder abduction. D. To strengthen the clavicle. Answer: A. To increase the depth of the glenoid cavity. Explanation: the glenoid labrum is a fibrocartilaginous structure that deepens the shallow glenoid cavity, providing more surface area for the humeral head to fit, thus contributing to joint stability. The long head of biceps brachii tendon passes through which anatomical structure in shoulder joint? A. Rotator cuff. B. Subscapularis tendon. C. Bicipital groove. D. Glenoid labrum. Answer: C. Bicipital groove. Explanation: the long head of biceps brachii tendon passes through bicipital groove, also called intertubercular sulcus, of the humerus. This tendon helps stabilize the shoulder joint by securing the humeral head in the glenoid cavity. The scapulohumeral rhythm refers to A. The movement of scapula and humerus during shoulder flexion and extension. B. The coordination of shoulder joint and elbow movements. C. The interaction between rotator cuff muscles and the scapula. D. The sequential movements of scapula and humerus during arm abduction. Answer: D. The sequential movements of scapula and humerus during arm abduction. Explanation: scapulohumeral rhythm refers to the coordinated movement between the scapula and the humerus during shoulder abduction. For every 2 degrees of humeral abduction, the scapula rotates 1 degree. This rhythm is essential for efficient shoulder function. Which of the following muscles is not involved in shoulder flexion? A. Pectoralis major. B. Deltoid, anterior fibers. C. Latissimus dorsi. D. Coracobrachialis. Answer: C. Latissimus dorsi. Explanation: the latissimus dorsi is primarily responsible for shoulder extension, adduction, and internal rotation, not flexion. The pectoralis major, deltoid, anterior fibers, and coracobrachialis all contribute to shoulder flexion. The term impingement syndrome in the shoulder refers to A. Inflammation of the bursa and rotator cuff tendons. B. A tear in labrum. C. Dislocation of humeral head. D. A fracture of clavicle. Answer: A. Inflammation of bursa and rotator cuff tendons. Explanation: impingement syndrome occurs when rotator cuff tendons or the subacromial bursa become irritated or compressed during shoulder movement, leading to inflammation and pain, especially during overhead activities. The shoulder joint is most stable when the humeral head is in which position? A. Full flexion. B. Abduction and external rotation. C. Adduction and internal rotation. D. Extension. Answer: B. Abduction and external rotation. Explanation: the shoulder joint is most stable when the humeral head is in abduction and external rotation, which allows the rotator cuff muscles and ligaments to stabilize the joint. The coracoacromial ligament forms part of the A. Coracoacromial arch. B. Rotator cuff. C. Acromioclavicular joint. D. Glenohumeral joint. Answer: A. Coracoacromial arch. Explanation: the coracoacromial ligament forms part of the coracoacromial arch, a bony and ligamentous structure that protects the head of the humerus from upward displacement and helps limit the movement of the shoulder. Which of the following muscles is not a part of the rotator cuff group? A. Supraspinatus. B. Infraspinatus. C. Teres major. D. Subscapularis. Answer: C. Teres major. Explanation: the teres major is not part of the rotator cuff. The rotator cuff consists of the following muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. The teres major is responsible for internal rotation and adduction of the arm but does not contribute to the stabilization of the shoulder joint. Which of the following structures contributes to the deepening of the glenoid cavity and increases the stability of the shoulder joint? A. Coracoid process. B. Glenoid labrum. C. Acromion process. D. Rotator cuff muscles. Answer: B. Glenoid labrum. Explanation: the glenoid labrum is a fibrocartilaginous structure that deepens the glenoid cavity, making the shoulder joint more stable. This